This is going to be a short lecture just with a few tips for prescribing antidepressants. Prescribing antidepressants can be a science and an art, and this is because you must consider the best practices that are indicated with their use. And you also must consider the patient and each individual's unique response to the medications. They don't always work the way you think they will. So here are some very basic tips to consider when prescribing antidepressants. So let's talk about some general prescribing guidelines. These tips are not exhaustive, but may help establish a structure when considering treatment. The goal of antidepressant treatment is the complete remission of symptoms. Second thing is selective serotonin reuptake inhibitors, SSRIs, are a general first-line choice for treating major depressive disorder and related disorders due to a more favorable side effect profile. 3, pick an antidepressant that best fits the clinical picture of the patient. 4, treatment failure and resistance is a complication of treating depression, but there are some helpful options to consider. And then finally, you should be aware of the safety concerns associated with antidepressant use. When choosing a medication for patients with depressed symptomology, you want to think of a medication that is effective with the least side effects. This is what makes the SSRIs an attractive first choice. Generally, escitalopram or Lexapro, sertraline or Zoloft, and sometimes fluoxetine or Prozac are first choices. Lexapro is generally considered to be the best tolerated SSRI with fewest side effects. Bupropion or Wellbutrin could also be a good choice if it doesn't cause sleep disruption in the patient. For patients who have secondary conditions, your antidepressant choice may be determined by those medications that have dual efficacy. For example, bulimia, fluoxetine or Prozac would be an appropriate choice. For smoking cessation, bupropion. For fibromyalgia, duloxetine or Cymbalta. And the same for diabetic neuropathic pain. Anxiety, you want to think about the SSRIs or even possibly TCAs. If you have a patient who is underweight and also maybe even have insomnia, mirtazapine or Remeron is a great choice. And then finally, ADHD, Wellbutrin or bupropion would be the drug of choice. Treatment-resistant depression is generally considered to be defined as 2 prior trials of an antidepressants for clinically recommended dose and time. Some possible strategies for the next steps include 1, switching to a different class of a drug. For example, if you trialed SSRIs, then try either bupropion or one of the SNRIs. Mirtazapine could be an option also if there is no concern about weight gain. A TCA would be the next step, or an MAOI. Another option would be to try a combination. This would look like adding bupropion with an SSRI or an SNRI, or maybe adding an atypical antipsychotic like Abilify. Other options, if those don't work, would be non-pharmacological, like ECT or transcranial magnetic stimulation. Considering safety concerns, all depressants carry a black box warning of increased suicidal risk. Even though this has been called into question recently, the warning exists, which prompts providers to assess for increased suicidal risk once initiating antidepressant therapy. Another safety issue to consider is the switch to mania that may happen to at-risk patients. Use caution with patients who have a family history of bipolar disorder or who have had a history of mania or hypomania. Avoid abrupt discontinuation of antidepressants, particularly SSRIs and SNRIs. Discontinuation syndrome, although generally self-limiting, may happen a few days after stopping antidepressants. Symptoms such as diarrhea, headache, nausea, dizziness, irritability, sensory disturbances, bad dreams, and insomnia may indicate this condition. Serotonin syndrome is a potentially life-threatening situation associated with the use of serotonergic antidepressants. It is most commonly seen when serotonergic antidepressants are used with other serotonergic drugs, such as the migraine medications, triptans. Symptoms of serotonin syndrome include hyperthermia, tachycardia, hyperreflexia, nausea, vomiting, and even myoclonus. Thank you, and this concludes our lecture.